Today I'm going to talk regarding the telediabetes. So we know that as our previous esteemed speaker has said, this telemedicine program is running for quite long time, but it is become popular only nowadays recently because of need of our patient, even our healthcare providers, and mainly it is because of this pandemic COVID-19, because people want to avoid the contact, they want to have a minimum traveling, and also because of lots of restriction in the traveling. So let's today I'm going to discuss how this telediabetes is helping in the people who are having diabetes, whether it is type 2 diabetes or type 1 diabetes, and what are the evidences are there, and in what way we can help the our population who are suffering from diabetes. So um, uh, we know that the diabetes and its costly complication have attained an epidemic proportion across the globe and are currently considered as one of the most challenging public health problem. And diabetes, irrespective of the type, whether it is type 1, type 2, its ethnicity and the age of onset, and it is a progressive disease culminating in a multitude of the complication. So this is very familiar uh, picture. It's taken from the IDF. Here we can know the India is only second to the China as far as the population of diabetes is concerned. And more importantly, 1 in 6 adults with the diabetes in the world come from the India. And the diabetic population in India rising very fast. Currently, the prevalence of diabetes in our country is approximately in between somewhere 9 to 10%. And most importantly, 1 in 2 diabetic adults who are suffering from diabetes, they are undiagnosed. They are not aware of having diabetes. Another important thing, 4 out of the 5 people with the diabetes, they live in the low and the middle income countries. Like our country usually comes in the middle income country. So the population of diabetes is more. And the important thing is that 87% the mortality is mainly from the low and the middle income countries, and but the important thing, only 35% of the diabetes related health expenditure is spent here. So what we are expending in the diabetic care is not much enough. What are the issues actually? Let's see. When because of rising prevalence of diabetes, because of rising prevalence, and also because of shortage of trained diabetologists and complexity of the treatment, translate to the poor health outcome and failure to reach the desired therapeutic target. So a systematic, organized and coordinated approach is crucial for the optimal management of diabetes, where both clinician and patient play a critical role. The strong evidence demonstrates the beneficial effect of the patient monitoring and education focus on the prominent role of individual self-care with the support of healthcare professional. So all this bring into the focus of great advantage in the telecommunication technology and information technology, which can be exploited to improve the diabetic management. What is the usefulness of the telediabetes in our population? We can say that the telediabetes is a simple term, and it is defined as a use of telecommunication to support the diabetes management. So what does it do actually? It empowers the patient to make a decision about the goals, therapeutic option, and self-care behavior, and to assume responsibility for daily diabetes care. And more importantly, the patient who live in the rural area, like our most of the population, we know that around 60 to 70% of the Indian population still live in the rural area. They're having a more barrier to receive the specialty care. And these barriers are because of long travel distances, costly expenses to the urban area where the specialty care is often available, created the challenges for these patients to achieve the good health. So telediabetes, the exchange of medical information via the electronic communication between the patient and healthcare provider, has emerged as a promising solution in such situations. So what are the various type of telediabetes? I will not go into very detail because our previous speaker has already spoken about this. So roughly this can be classified according to the mode, time and purpose of the communication and individual involved in the communication. So when we consider the mode of communication, it can be text, it in the form of video, it can be form of the audio. There are various means for the text, like more like familiar or more easily available is WhatsApp, Facebook Messenger, emails, video like Zoom, Microsoft Team, Skype, and audio. Simply we can use the phone, uh, voice over the internet, and even the various audio apps are available. As far as the time of communication, like it can be either real time synchronous like video, audio, or text chat, or asynchronous like we can use the email. And when for the purpose of consultation, it can be first consultation, or can be used for the teleconsultation, or it can be the follow-up consultation. And what are the who are the individual involved in this tele consultation? It's like patient to doctor, caregiver to doctor, doctor to doctor, or healthcare worker to doctor. So like various modality, like various people can involve in the teleconsultation as far as the diabetic care is concerned. So what are the practical considerations when we are talking of the tele-diabetes? First, most important is the privacy and confidentiality of the patient data should be maintained. Patient identification should include the name, age, address, phone number, email ID, identity card, and etc. Whichever the important things are required. Consent of the patient, either it is implied or explicit, should be obtained, and the patient's medical records should be maintained along with the laboratory and the radiological report and the prescription. Other important thing, if the telemedicine consultation is not considered to be adequate for the clinical evaluation, the patient should be called for a face-to-face consult at appropriate time and the place. This is very important. Many times in the when the patient with the diabetes having the various complication and we're not able to make out via the teleconsultation. Any artificial intelligence or machine learning application is not allowed to consult on the behalf of the medical. Similarly, the Schedule X or any narcotic or psychotropic substances are not to be prescribed by any mode of teleconsultation. So these are the few practical guidelines are there. And what is the telediabetes uses? Like it can be like virtual patient physician appointment. It can be used for the diabetic education at the distance placed in some community. It can be for the particular patients or patient group of the patient for the behavior therapy and the counseling. It may be counseling regarding the diet or lifestyle modification. Or telediabetes can be used for the like school-based video conferencing session with the diabetic healthcare provider. And one of the most promising use nowadays is coming in the diabetes retinopathy screening. So we can use the various modality available in the tele consultation for the screening of the diabetic retinopathy. So what are the advantage? Like frequent traveling to the like clinical appointment is inconvenient for patient with the busy schedule, and particularly burdensome for the patient living in the rural or underserved area. So this is one of the major problem for the patient coming to the cities. Also, like patient who are elderly and the people with the disability, leading to the reduced adherence to the clinical appointment. So for such patient, it is this telediabetic concept is very useful. So the patient physician interaction are essential for improving the health outcome and preventing the long-term complication in the patient with the diabetes. So this can be maintained via the virtual telemedicine appointment, enable patient to interact with the physician and educator without the barrier of distance and commute time. So telediabetes, the patient can avoid the traveling, and still the patient physician interaction can be maintained. So telediabetes is dedicated to support and guiding the diabetes management digitally and aim to reduce the on-site visit. So let's see what are the evidences are available in the literature for various usefulness of telediabetes, like which are the more common area where we can apply this telediabetes. The foremost is like for the glycemic control. The use of telediabetes visit has been well studied in the population with the limited access to specialized clinician registered dietitian and diabetes educator. In one of the meta-analysis, like it contain around more than 20 papers they analyzed, and what they have found, the mean reduction in A1C was significantly higher in the telemedicine group. And even the further, when they analyze the subgroup, and it has shown that the higher reduction of A1C was seen in the older patient. And also more importantly, the long duration program provided a higher reduction in A1C compared to the study with having the follow-up of less than 6 months. And in other study, which was like it was a randomized control trial, it was a prospective study when they studied the two groups. In one group, they have used the internet-based healthcare system. Other was just a, like they have called the patient for the visit. And what they have found that them, like in the internet-based healthcare system of the integrated management in diabetic, have a better glycemic control, effectively improved A1C levels, and decreased triglyceride level, and also the enhanced patient adherence to the medical team's instruction. So we can say that each teleconsultation offer an opportunity for continuing diabetes education and drug compliance. The teleconsultation offer not only a chance for the doctor to fine-tune the treatment, but also a chance for a patient to develop more awareness and knowledge by interacting with the diabetes educator, nurses, and the dietitian. And more importantly, the frequent telemedicine follow-up based on the SMBG, that is the self-monitoring blood glucose, enable the slow and steady titration of drug doses. And because of this, there is a less chances of developing hypoglycemia. And also the telemedicine ensure the achievement of the treatment target of glycemia in motivated patient. So collectively, we can say that this finding of affirm that the tele-diabetes care model may produce similar or better health outcome than in-person care model with the greater time and cost efficiency. What about the screening? I think this is one of the most important part of management of, or we can say the in any community, like management of the diabetes. It is important because like half of the diabetes cases worldwide, not only in India, they are unrecognized. And screening to identify the asymptomatic individual who are likely to be affected by diabetes is recommended. Like there are certain criteria, like you should always screen the patient whose age is more than 45 years, or those with having the family history, and those who are having, like those are obese or overweight, and they are coming from the some specific ethnic group. Like in one of the study which was published in UK, they have made a online tool, and they have asked the people to use this online tool and fill there the various risk factor. So they calculated the risk factor of the individual person, and whose risk factor is increased. So they have given like the fast access of NHS diabetic prevention program, and also they have arranged a hotline call for these patients who are having the high risk factor. And also the people who are in the high risk factor, they have advice for the healthy lifestyle, and also given the appropriate cooking recipe. And like during the first 3 months, after the launching their apps, around 3 lakhs people have used this tool. And more importantly, like around 5,000 self-referred to the practitioner for laboratory screening for diabetes due to positive pre-screening result. So in such a way, like not going much into the involving the human being or involving the resources, just a simple application, they motivated the people. And many people who are having the high risk for the diabetes, they have gone to the laboratory and got themselves laboratory test done for the screening of the diabetes. Lifestyle modification, like dietary modification and intensification of the physical activity, are the keystone of the glycemic control in the people with the pre-diabetic and over type 2 diabetes. There are several telemedicine programs have been conducted, including diabetes prevention program and randomized control trial. The method used include regular phone and video calls, virtual education session, remote exercise, and dietary coaching, as well as the virtual physical exercise session. So the meta-analysis in which they have included like around 17 study, and what they have found with the telemedicine lifestyle modification measure, there was a modest reduction in A1C and the weight. And also it was suggested that the automated mobile transmission or the real-time feedback modality strengthen the efficacy of these intervention. Similarly, use of telediabetes is very important in the diabetic food screening. We know that the diabetic food diseases include the foot ulcer, infection, and the gangrene, and it is a leading cause of the global disability burden. About half of the people who develop the diabetic foot disease experience a recurrence within 1 year. So the long-term medical management to reduce the risk of recurrence is therefore important to reduce the global diabetic foot disease burden. Video call could be suitable for evaluating the issue of the diabetic foot that are apparent visually on the presentation. So in this study, what they have done, they have randomized the two group. In one, they have followed with the patient with the medicine monitoring, other was with the standard care. And what they have found in the patient who were diabetes with the diabetic foot disease, there was no significant difference regarding the amputation and healing between the telemedicine and standard outpatient monitoring. However, for the telemedicine monitoring, a higher mortality was noticed. But since the sample size was small, so they concluded that for this further study are needed to investigate the effect of telemedicine on the mortality and other clinical outcome, and to identify the patient subgroup that may have a poor outcome through the telemedicine monitoring. In other randomized control study done, in which they have used the telemedicine and the standard outpatient care, and they have found there was no significant difference in the healing time between the two groups. And telemedicine group has a significantly lower proportion of amputation, and there was no significant difference in proportion of death, number of the consultation, and patient satisfaction between the group. So the results suggest that the use of telemedicine technology can be relevant alternative and supplement to the usual care, at least for the patient with more superficial ulcer, because these patients require long-term management of the diabetic foot disease, mainly the ulcer. So telemedicine will be having a great help. They can patient can be monitored at their place for the management of the diabetic foot. So telemedicine diabetic approach capable of remotely monitoring the key risk factor of diabetic foot disease. It is believed that the utilization of telemedicine approach will offer an innovative means to approach the assessment of the risk factor in the people with the diabetic foot disease. But it remains to be seen what broad impact this can have on prevention of diabetic foot disease. So this, I mean, still is in the quite preliminary stage, and maybe more data will come in the coming years regarding the diabetic foot disease management. And other usefulness of telediabetes in the screening and the management of diabetic retinopathy. Telemedicine program, it found it is beneficial in the management of diabetic retinopathy, and we know that this is a leading cause of legal blindness among the Indians, and there are several risk factors for diabetic retinopathy progression can be managed through telemedicine, including poor glycemic control, hypertension, and dyslipidemia. And particularly in the developing country like India, where the access to healthcare system is limited, and large proportion of the population live in the rural area. So inexpensive, easily applicable, and reliable tools and the staff who are trained to conduct eye investigations are needed. And this is one of the prototype of how this telediabetic can be used in the screening of diabetic retinopathy. Here the patient's fundus photograph can be acquired by the trained person, and then it can be transmitted through one server, and then ultimately from the server it can go to the medical person where the reporting can be done, and then again the report can send back to the patient, and if required the appropriate action can be taken depending upon the reports. So wide variety of simple retinal camera that can be used by the trained non-ophthalmologist personnel have been developed, So it will help to identify the people who require consultation with the ophthalmologist. In one of the study, like what they have found out, like when these patients were offered regarding the digital uh, screening during the primary uh, care visit, around 40% agree, and all the patient who agree for the digital screening, they have done the their fundus screening. But patients, around 60%, they prefer for the ophthalmologic examination with the doctors. But out of which who prefer the ophthalmologic examination, only 30% have done the initial screening. So what I want to say here, the telemedicine has a power of integrating the retinopathy screening and preventive care into the primary care visit, and enabling the identification of retinopathy at its early stage, and helping the patient in reducing the financial and quality of the life costs incurred by the vision loss. Like what is the role of telemedicine in the rural India? Like with limited resource and skilled manpower, it is not possible to have a routine eye examination to identify and treat these patients on regular basis in the rural area. So telemedicine is a possible answer in this situation where the patient could be remotely screened and appropriately advised. So with the advent of several technology advances such as low cost handheld non-magnetic camera, increase the capability of the smartphone to take the external eye and the retinal photograph, coupled with the improving broadband connectivity, teleophthalmology in the management of the diabetic retinopathy could be a really not too distant future. So this study was done in one of the center in the North India, and where they have found out when it was implemented in the primary care setting, the retinal tele screening increased the rate of evaluation of the diabetic retinopathy for the patient in the rural and underserved setting. So probably it is one of the most useful thing to do for the diabetic patient in the rural and underserved area. Similarly, in the telediabetes can be used in the our rural population, and and this is more helpful as majority of our population still live in the rural area. There is a lack of awareness due to illiteracy, lack of physicians and paramedical staff trained in the diabetes, limited access to healthcare due to problem with the transport infrastructure, and unaffordability is the major problem due to poverty are some of the major obstacle to delivering the diabetes health care to the rural area. So the screening for diabetes is seldom done in the rural area because of these reasons, resulting in much higher burden of the undiagnosed diabetes in the rural area, and also they present with the very severe complication of the diabetes. So this could be potentially lead to delayed diagnosis and improper treatment, which causing the uh, diabetes complication. So telediabetes can assist the healthcare system organization and provide in expanding access and to improve the quality of the rural health. Using the telediabetes in the rural areas to deliver and assist with the delivery of the healthcare services can reduce or minimize the challenges and burden the patient encounter, such as transportation issue related to traveling for the specialty care. And also is improve the timeless and communication within the healthcare system. Uh, this is one of the project which is currently very successfully running in Tamil Nadu near the Chennai, where they are approaching the population. They are doing the primordial prevention, primary prevention, and secondary prevention, and also they are treating the complication, and they are doing the tertiary prevention also. So in this way, we can say that the telemedicine help to effectively use the services of trained specialists who are simply not available in the rural area for developing countries such as India. So this is a photograph of our telemedicine center, which has a lots of facility. We do the various activity, and this is our medicine mobile van, which is also help in going to the remote places and serving the people. So how to judge whether this program is success or not? It can be judged by the, like in the case of telediabetes, the successful treatment of the diabetes. And the successful treatment of diabetes require the normalization of the blood glucose, normalization of the A1C, blood pressure, and normalization of the like lipid profile, reduction of the weight, improvement in the waist circumference, and also the screening of the various complications. So to attain the multiple goal of therapy in a single patient, we have to have a continuous education, motivation, empowerment, and advice on the healthy food habit, physical activity, and the accurate use of monitoring and injection devices are required through a structured tele-diabetes program. So what are the challenges of tele-diabetes? There can be communication error, inefficiency to respond to the question, inability of the physician to attend the phone can be provoking to the patient. Rigorous and continuous training and supervision of the multidisciplinary teams are required. Even though the slightest error in communication during the telemedicine consultation sometimes result in the serious consequences. So this we have to keep in the mind. And the patient in India, that is one of the like problem we also face. They are conventionally used to the physician visit to the hospital and receiving treatment advice only from the physician. So this taboo we have to break somewhere actually. And there are some barriers also for the medicine as far as the tele-diabetes is concerned. The important is the lack of technical knowledge and specific training, missing standard, and the doubt about its efficacy, success rate, and alter like practitioner patient interaction, all of which are negatively impact the acceptance of the telemedicine both by healthcare provider and patient. But what we are observing gradually, these things are improving, and now the both healthcare provider and the patient both are accepting the telemedicine consultation. And commonly reported issue also include like increased clinician work rate, data safety concern, and technical issues with the equipment. So these are some barrier to the success of that telemedicine. Just to conclude, it is crucial to engage the patient with the diabetes in their health and disease management to improve the quality of life and to reduce the diabetes related expenditure. The new generation of patient with the diabetes is more technologically inclined, and our technological capabilities are better as well. Now we have a faster internet service, pervasive smartphone, higher resolution camera, blood glucose monitoring system that synchronize with the mobile phone application, and advanced retinopathy imaging tool. The greatest potential of telemedicine lie in the providing easy access, especially by the people in the rural area where the healthcare resources are limited. So in this technology era, we may finally achieve patient-driven diabetes care that improve the patient's glycemic control, prevent complication, and reduce the time and the cost of both patient and the healthcare provider. So thank you for your patient hearing. I'm happy to answer any